Hi everyone, my name is Jean Cubalette with Latino Connection and the Kate Mobile Unit. It is my honor to present to you guys what I like to call Little Kate. Little Kate is our newest member of our family. She is 28 feet long and about 11 feet high. She will be partnering up with Dauphin County Human Services and Highmark and also Penn State Health to travel around Dauphin County to vaccinate homeless here in Dauphin County and provide COVID vaccination and education to those who are in the hard to reach areas that we might not get to see every day. So it is my honor to present to you guys Kathleen McKenzie with Highmark.
Hi everyone, I'm Kathleen McKenzie. I'm Vice President of Community Affairs at Highmark Blue Shield. Before we get to our honored commissioners, I just wanted to let you know that Highmark as an insurance company is very concerned about the health of this community. So last year when George Fernandez from the Latino Connection came to us and asked us to do COVID testing, we jumped right on it. And there's a huge van called Kate, and we've been taking that across the state last year doing COVID testing. This year now it's about vaccinations. So this Little Kate and Big Kate go across the state doing COVID testing. We have to also remember that the State Department of Health has been very pivotal in making sure that we have funding for this effort too. So the State Department of Health has been very pivotal. Penn State Health, they've been giving all the vaccines through every one of these efforts. Kate is very important. It's a mobile unit. That means that it reduces barriers to care. Barriers such as language. Everyone on this van is bilingual. They speak Spanish. They speak to our Latino community in the language that they use and answering questions that they may have from their own standpoint. So it's very important to break down some of these barriers when it comes to health. The second thing is access and transportation. For people who can't jump on a bus or find a car to get somewhere, or they think they may have to go to a hospital, the answer is right down the road. This past weekend, we were at Central Dauphin School District. We did kids 12 and up. They just had to drive through. The parents had to drive through, stick the kid's arm out the window, and they got a shot. So it's as easy as that. You go to your school district and you get a shot. The van is there. The week before that, we were working with the agricultural workers in Pennsylvania. We were in the beautiful farmlands of Berks County, working with the mushroom workers from Giorgio Foods. 1,000 first language, Spanish-speaking farmers, making sure they and their families were getting vaccinated. And now we're here. Dauphin County, thanks to the commissioners, put the vaccination of this community first. And we're here and we're going to work with the vulnerable populations of Dauphin County. So thanks to the Department of Human Services, understanding the need for the vulnerable populations, and thank you for our commissioners and their leadership in making sure that the vulnerable populations of our community are getting exactly what they need right now, and that's vaccinations. So with that, I'm going to turn it over to our vaccination leaders, and that would be our two commissioners. Commissioner Hayes first.
Prees, potato. He's much better looking than me, by the way. Folks, thank you for joining us today. Thank you to the media for the incredible job that you've been doing during the entire pandemic, getting the message out there. This is a true collaborative effort that Commissioner Hartwick has been working on with our partners here today with us for close to a year now. So I'm not going to belabor much longer because this is George Hartwick's thing that he's been spending so much time on. Commissioner, thank you for your commitment and the amount of time and passion that you put into this project. And as a fellow commissioner, I'm honored to be standing here with you today, and I'm going to turn it over to you at this time. Thank you, sir.
Appreciate it. Yep. Thank you, Commissioner Prees. Those comments are certainly not. The credit goes to a collaboration, quite frankly, and not to me. God put you in a position to try to bring people together and try to remove barriers from the people who do the work every day. And boy, do we have an incredible group that cares about the least of us in this community. This was a true collaborative effort between Dauphin County Human Services, CASH, and every other human service serving group that actually serves the homeless population. You'll see both in the events that we are going to be at, the level of education that's involved, the level of collaboration that's involved, that just truly is an all hands on deck. I know when we were first faced with this pandemic, all of us have had significant conversations about ensuring that we had a pandemic plan for our homeless population. We know that they are one of the most vulnerable populations in this community, and we also know that being able to ensure that we had a safe plan to not only deal with the emergent issues that were happening as a result of the pandemic, but when we got to this phase about ensuring we also don't assume that somebody's going to come down to a government office building to be able to, or to a vaccination site and actually get vaccinated. We have to meet people in all levels of services, particularly in the human services, where people are at the time they need it. And we have to understand that there's a significant amount of cynicism and mistrust related to system involvement. There's a lot of misinformation out there about vaccinations, which we need to clear up, and we want to make it clear today that we want to provide safety and the vaccination opportunities to every resident in this county. And that includes those individuals that may be currently homeless or chronically homeless, that we want to ensure that they have access to the vaccination and they do it in a safe manner, in a way that is professional, a way that their confidentiality is also going to be a key in this thing. I mean, when we talk about it, it's just not folks that are carrying insurance cards that are able to be eligible for the level of service that we are providing here in Dauphin County. I want to thank George Fernandez for having a vision early on. I know he was on my back saying, we got to use Kate, we got to use Kate, we got to figure out a way to get it more engaged. The ability for us to have a collaborative partnership with CASH and so many other agencies. I'd be here all day naming the agencies that are working along with being able to serve our population. And quite frankly, in Dauphin County, and you can see it out here almost every day, we have a community that steps up and prides itself on helping those who need help. They know that the true gift and the blessing is in giving, and the ability to be able to ensure that the people who are struggling out here on the streets, whether it's a current economic situation, whether it's an issue with drugs and alcohol, whether it's a mental health issue, whether it's a homeless veteran, they've come together and stepped up and provide a network of support better than almost anywhere I've been, and I serve the entire country in a role for human services. This is just yet another example of the level of collaboration and commitment we have to serving all residents in this county. And I couldn't think of more professional partners or a better team to be able to go out and provide the vaccinations. I believe this was the actual grant for this particular project was through the Emergency Solutions Grant, and it was administered by the Department of Community and Economic Development. I know we've had 2 rounds of the Emergency Solutions Grant so far, and this was one that we planned on early on. I think it was February 24th or February 25th when we submitted the application. It was clear that emergency management needed to be a component, which we believe in Dauphin County we have an excellent top-of-the-line emergency management level of response, which is overseen by Commissioner Prees. They are really top-notch and have been engaged in both planning the vaccination clinic you saw up at Hack to make sure it was coordinated and a part of this planning process. And they were actually a required component for us to be able to receive the money from the Department of Community and Economic Development. So this has been planned out. I've provided a list to you of upcoming events. I believe Moderna, if I'm correct, is going to be the shot that is going to be used for this population. So, you know, there's going to be a requirement to try to get folks the second shot. And I know we've had some conversations about case management, how we plan to do outreach, and the level of importance in following up with the population to try to make sure they're here for the second shot. But with this group, barriers aren't problems, they're opportunities to figure out ways for other folks to step up to solve the problem. I couldn't be prouder to be a small part of this in a role of leadership, but more importantly for the staff of the county, for those who are involved in CASH, and for those who we serve that is a homeless population. they know that we have people here in county government that are considering their needs, concerned about them, and want to ensure that they are safely vaccinated so that vulnerable population doesn't become sick and a major part of concerns as we move forward and trying to move outside and recover from this pandemic. So thanks to all involved. If there's any questions, we'd be glad to answer them. We've got some folks here from CASH, Dauphin County Human Services, but that's the basics. If you want to go through the actual sites as they will be presented to the individuals coming through, I know we have capable individuals to do that as well. So thank you for coming out and covering today. More information, quite frankly, we can get out about this, hopefully the better level of participation. So as Commissioner Prees said again, thank you very much for your willingness to get this message out and serve our most vulnerable population.
Any questions?
So I know that it seems like this really addresses the barrier for accessibility transportation. You mentioned the distrust aspect. How have you, I know you said you've done a few events already, have you been able to, you know, talk to people and change their minds a little bit, and do you see that being a possibility?
I think, you know, again, the education is going to be an ongoing effort. We've had even our providers attend a webinar from a noted physician that was able to give helpful tips about ways to engage, the level of conversation to have, what you're going to hear related to concerns, and so we also trained the folks that are doing the outreach in ways to do that kind of engagement and the level of information that's involved. I think that's going to be an uphill battle we fight. A lot of times, even if you're homeless, you have access to social media, and we know of all the challenges that have been out with misinformation, but also somebody's experiences with their system, a diagnosis, or another concern could be, you know, really a barrier. We believe that establishing relationships, building trust, talking about ways that we can provide services, and again, this is just one component of what we're attempting to try to do to serve the whole person, from healthcare to figuring out ways to deal with their basic necessities and figuring out ways to provide blankets and food, all of those things, doing case management through our mental health department, through the Bethesda mission in cooperation with the Daily Bread. So there are people in this community that have established a link of trust and provide services to individuals that we're serving, and we're relying heavily on those individuals to be able to really get out and engage. We're not trying to provide a new level of trust and a whole different level. We're relying on those individuals that currently serve our population to really deliver the message, and those individuals trust, in order to make sure people know they're going to get here safe. They're not going to be accosted. There's not going to be anybody serving warrants. We're not doing anything related to any kind of setup. This is an opportunity to get vaccinated. There is not going to be any other level of distrust that's associated. And you can take my word, or you can take the word of the individuals that are going to be doing the outreach in this effort, which have that established level of trust.
Anyone else? Randy, you want to make some comments?
I just think it's important to understand that even prior to the pandemic, we had a network, and we've relied heavily on that network serving the homeless population. These are relationships that have been years in the making, and so the folks that they see every week, sometimes multiple times a week at various locations, including the encampments, these are the same folks who've been talking to them about the vaccine and the mobile Kate coming to them. And so I think we're in a good place to have folks receive the vaccine, and we've done a lot of prep, and now it's a matter of relying on those relationships that have been built over many, many months.
Any other questions?
I think we would all agree that this pandemic has been a scourge on all aspects of society and the population, the entire world. Socioeconomic boundaries, it doesn't know, race, age, it's everywhere. And when you see folks like this working together to serve the underserved community out there, the people that are in their time of greatest need, it shows what type of people you are as well, working together to help those folks. So thank you very much.
Thank you.
Thank you.